Despite the fact that the progression-free survival in multiple myeloma patients is improving, some patients respond poorly to treatment, highlighting the need to identify these patients at higher risk for a more unfavorable disease course. It has been recognized multiple times that high levels of circulating tumor cells, as for instance demonstrated by our group and the PIVA group, are related to an unfavorable disease course. However, the pathobiology behind this unfavorable disease course is unknown, and therefore our group has been focusing on this for a few years. So for this study, we analyzed paired bone marrow plasma cell samples of newly diagnosed myeloma patients and their peripheral blood samples, the plasma cells from there. For the method we used, we decided to perform single-cell RNA sequencing. Through this method, we can analyze the transcriptome per cell in every patient. So this is a very specific method, and through this, we can analyze specific subpopulations of the different bone marrow plasma cells and circulating tumor cells. And we can easily analyze the differences between the two groups. So we analyzed the bone marrow and the peripheral blood samples of 5 paired patients with high levels of circulating tumor cells between 0.5 and 8% of circulating tumor cells. Between the peripheral blood and bone marrow samples of these patients, we did not see any differences. Not in their clustering, so we did not identify a specific subpopulation in the peripheral blood, but also not in differently expressed genes between the two sources. So for them, we decided to analyze the bone marrow samples of 20 patients because we now thought that the difference in biology in the disease may lay in the bone marrow and not in the peripheral blood. So for this, we analyzed the bone marrow samples of 8 patients with high levels of circulating tumor cells. They had plasma cell levels in the peripheral blood between 3 and 22%, and very low levels of circulating tumor cells. These patients had CTC levels between 0.006 and 0.02%. Now, and when we looked into the specific bone marrow samples of these two groups, we did see that there were genes upregulated in the patients with high levels of circulating tumor cells related to proliferation and cell cycle. And because we had the whole transcriptome of these patients available, we could actually perform a very sensitive method to analyze in which cell cycle the patients were, namely the cell cycle analysis. With a cell cycle analysis, we load in a list of known G2M and S phase markers, and each cell we performed single-cell RNA sequencing on was labeled in which phase they were, so cycling or non-cycling. And what we then saw is that patients with high levels of circulating tumor cells had a significant higher percentage of cycling cells in their bone marrow samples. This indicates that patients with high levels of circulating tumor cells have a more proliferative phenotype in their bone marrow. And this may be the mechanism behind this more unfavorable disease course in this group of patients. So, as I mentioned in the beginning, we try to identify those patients with high-risk multiple myeloma, and patients with high levels of circulating tumor cells are identified as high-risk multiple myeloma patients. We do, however, treat them as regular myeloma patients, but based on their gene signature and based on previous studies, we know that it could be that these patients respond worse to therapy and may need a more personal-based therapy or more close monitoring in the future. And hopefully with further analyzing this mechanism we are now starting on, these are the very first results of this study, we hope to be a part of that. What we saw is that patients with high levels of circulating tumor cells have a more proliferative phenotype. However, what is the reason for this proliferative phenotype is something we do not know. So we now have two hypotheses. One, that this proliferative phenotype is based on an cell intrinsic mechanism. So for instance, well-known mutations in myeloma make the myeloma cells proliferate more. However, because the common mutations in myeloma, as del17p and translocation 1140, were evenly divided between the two groups, this is something we think is more unlikely. However, we will be performing DNA sequencing on a few of these patients to further analyze specific mutations in patients with high levels of circulating tumor cells versus low levels of circulating tumor cells. A second option we are working on, which is very exciting, is that there may be an extrinsic source that makes these myeloma cells proliferate more, or pushes them more into the size cycle, namely the microenvironments. So for this, we have started single-cell RNA sequencing on the microenvironments of these plasma cell samples we already analyzed. And we will be hoping to further have these results in the future. I would like to thank all my teammates from the Rotterdam Cupedos and Selneveld group, and my supervisors, Peter, Annemiek, and Tom, who have been of great help in this research.